My name is Professor Langhorst. I'm director of the clinic for internal and integrative medicine at the hospital of Bamberg, and it's the chair for integrative medicine of the University Duisburg-Essen. The CellTolerance test gives us for the first time the chance to make the diagnosis of a barrier dysfunction directly at the target organ, the duodenum in this case. So, first of all, the patients have to be prepared. When we start with the procedure, they undergo a regular gastroscopy. We placing a probe via the working channel onto the surface of the duodenum, and we check with a 1,000-time magnification on the cellular level for a barrier defect. If we rule out a primary barrier dysfunction, we apply the 5 most known agents from scientific literature connected with atypical food intolerance. As soon as the 2 criteria, the leakage of the contrast and the cell shedding is fulfilled, the procedure is completed and we'll end the procedure. So we have 2 studies, one aiming for Crohn's and colitis and another one on IBS, and this is the one which is almost done. So we included about 120 patients with IBS. And first of all, we could show with this procedure that more than 60% of the patients showed a primary or secondary barrier dysfunction. And our results in the IBS patients show that up to 40% could underwent a second procedure. And of these patients, the results in terms of symptom relief, getting better quality of life, but as well stress level, depression and anxiety, we show high significantly and highly relevant improvement of the symptoms. And what is more, and what is really exciting, we double-checked in terms of confocal laser endoscopy, and we could show that more than 70% showed an improvement of their barrier dysfunction, and almost 50% showed a complete healing of their barrier dysfunction. First of all, the diagnostic procedure is easy for them because they are asleep during the gastroscopy, and then they are very thankful when we talk to them about primary or secondary barrier dysfunction induced by a food allergy. So they get a clear direction for a new therapeutic approach. We put them on a multimodal treatment, including various modules which aim exactly to stabilize the mucosal layer. Almost 1 of 10 people all over the world fulfill the criteria for IBS. So it's a huge syndrome. And there is a significant subgroup of patients who suffer from food intolerance. And it's the major challenge to find these patients by the right diagnosis, so you can really help them by the right therapy. So in our patient group, we encounter it quite often, and my guess is that it's quite underestimated in all the IBS patients. The typical journey of an IBS patient with food intolerance is that it takes years and years to get the right diagnosis. Typically, the patients have a long medical history with an unsolved problem. Modern gastroenterology has a variety of tests, but when it comes down to atypical food intolerances, it comes all down to diary, actually. The main limitation is that this is a subjective way to find a diagnosis. So in many cases, we fail to find a clear picture, to find this food which is causing the trouble. Approximately 10 years ago, I attended in an international meeting where the confocal laser endoscopy was presented in another field of gastroenterology. So I was interested in the method, and then we started discussing that this might be something for functional diagnosis of atypical food intolerances. And so I stick to it, and when I became director of my own clinic, I implemented the method in my all-day patient care. from the huge group of IBS patients with functional symptoms, the ones with the first suspicion on the impact of food to their symptoms are the ones who should undergo this procedure.